Alright, so this will be our first video. This will be our first video on appendix. Not first video, right? After the course outline, then we actually have this. Okay, so we'll be having an introduction to what appendicitis. Okay, I'll be having an introduction to appendicitis, and in this introduction, we'll talk about the definition. We'll talk about the possible causes of what possible things that will make the appendix inflamed, right? We have the symptoms here were listed out, and yeah, we still have the symptoms here. We have the complications, like basically if you leave this medical condition, I'm coming, let me say something. If you leave these medical conditions without treating it, it will result in some crazy things, right? They talk about the possible treatment. You talk about what the types, different types of what appendicitis that we have. All right. So, introduction to appendicitis. So that actually this appendicitis is a medical emergency, right? And one of the characteristics of what appendicitis is what inflammation of the appendix. What is appendix? Appendix is this small thing. Okay, I call it a small thing, but when it gets inflamed, you know that what is small but mighty, because it will make you not enjoy your whole abdomen, right? So appendix is actually a small finger-like pouch which is attached to the large intestine. It is actually a common cause of what abdominal pain, right? And it requires prompt treatment to prevent complications. These are the complications. Okay, these are the complications right here, which we'll be talking about, right? The definition. We say that appendicitis is inflammation of the appendix. And this can be acute or chronic, right? Causes. It could be that there was obstruction of the appendix lumen, that's blockage. It could be that there was an infection, and this infection could be from bacteria or virus. It could be that there was some intestinal worms or parasites that actually blocked it. Okay, then it could be some abnormal growth. Okay, it could be some abnormal growth or tumors. It could be some unknown causes. That's basically what idiopathic. All right. So yeah. Moving to the symptoms. It's a sudden or severe abdominal pain. All right. And this sudden or severe abdominal pain usually starts near the belly button. All right. Now this pain will radiate to the lower right abdomen. Okay. There's nausea and vomiting. When you're taking food, you feel like vomiting, or you might even be vomiting. Okay. There's loss of appetite. You're not enjoying your abdomen, so you don't even want to eat again. Right. There's fever, which is usually mild. There's abdominal tenderness, okay, or guarding. The person will not want you to touch the area, okay? They don't want you to touch it. There's rebound tenderness. Rebound tenderness is more of like when you are pressing the place, the patient is okay. But when you want to remove your hand, that's when the pain is like coming, okay? So that's what we call rebound tenderness. Then complications now, all right? This inflammation could lead to what? This inflammation could lead to rupture, all right? It could lead to abscess formation. It could lead to peritonitis, which is inflammation of the abdominal cavity, all right? It could lead to intestinal obstruction. It could lead to septicemia, which is blood infection. They're talking about a possible treatment. Is surgical removal of the appendix, which is basically what appendectomy. And this appendectomy, you could have the open surgery, or you could have the laparoscopic word appendectomy. All right. Then you can also administer some antibiotics if you suspect that there's infections. All right. Then supportive care. If you want to give some fluids, pain management, and the rest. Okay. Then types of this appendicitis. It could be acute. Okay, acute appendicitis, that's the one that is starting all of a sudden. All right. It could be chronic appendicitis. This one has been there for a long time. So it is coming and going. Okay. Then we have recurrent appendicitis too. That's basically having repeated episodes of this condition. Diagnosis. How can you be able to establish that what appendicitis actually exists in a person? You might want to do physical examination. You might want to do medical history. A good medical history can help you what um, diagnose like 80% already. The imaging studies like what CT scan, ultrasound, X-rays. They also do some laboratory tests, right? That's blood work, urinalysis, and the rest. Okay. So, brief history. In 1889, McBurney actually described the location and clinical features of appendicitis and the importance of what operative intervention and muscle split incision. That's why that area around the appendix they call it the McBurney's point. All right. So that's it about the introduction to appendicitis. See you guys.